Hello, my name is Scott Joransen. I'm one of the interventional cardiologists with the Cardiovascular Institute of the South in Meridian, Mississippi. I wanted to talk just a minute about peripheral artery disease in the lower extremities. It's something I'm passionate about. So in America, there's over 20 million people affected by peripheral artery disease. And also there's nearly 200,000 a year that are affected by amputations. And amputations, a person gets a significant amputation, their chances of being alive in 5 years is maybe 50%. So this has a huge impact on people's lives. Unfortunately, people will come in sometimes when it's either too late or almost too late. We have to emergently go in and open a blockage. And that's very gratifying and something I'm passionate about. But it's even more important if we could prevent these. And getting that diagnosed early is very important. And a simple screening test can find that. A physical exam and a simple ankle brachial index evaluation with blood pressure cuffs is very inexpensive and non-invasive and can recognize these things early when you can do lifestyle changes and medications that can alter that course and prevent the amputations from even coming or the ulcers that ultimately cause them. So one of the most important reasons to identify peripheral artery disease early is to be able to assess your cardiovascular risk and be able to head that off before you actually have a heart attack, because it's an extension of the same process. And the risk factors are the same: age, diabetes, smoking, and some of these things you can't change, like your age, but of course smoking cessation and treating your cholesterol and your blood pressure are very important for preventing these. And there's also antiplatelet medications that can be helpful as well. So if you have any of these risk factors, talk to your doctor about or your provider about whether you might have peripheral artery disease or not. And they can do a simple questionnaire, exam, and if appropriate, an ankle brachial index to assess whether you have peripheral artery disease or not. About 2/3 of people with peripheral artery disease don't have any symptoms from it. But if you do have symptoms, if you have pain in your legs when you walk, and certainly if you have sores or ulcers or discoloration in your feet or toes, please get evaluated quickly. It's one of the most heartbreaking things is when you see someone come in and they've already got ulcers or involvement of their bones where they have to have a partial or a major amputation that could have been avoided if they'd have come in sooner and gotten the proper care and evaluation.